my name is Mackenzie, and today I'm going to be doing wound care. So I'm going to start off by gathering all my equipment and verifying my physician order. So walking into my patient's room, knock, knock, knock. Hi, my name is Mackenzie. I'm going to be your student nurse today, and I'm going to be performing wound care. Can you tell me your name and date of birth? Okay, thank you, Mr. John. I'm verifying that with my order. So now I'm just going to provide hand hygiene. Place my gloves. There we go. Okay. And I'm just going to start by removing the dressing. Make sure I hold the skin intact while I place, while I pull up. Making sure not to pull his skin. I can kind of fold this tape back if needed, but making sure I don't fold it over my pad. And I'm going to lift straight up. And look, making sure the patient doesn't really see what's on the dressing. And so I'm going to assess the dressing, assess the site. I'm going to document if there's any drainage, if it's serious or not. And then I'll discard this in the biohazard bag, along with assessing the skin. And I'm going to remove my gloves, but for the video's sake, I'm not going to actually take them off, but I would remove my gloves, perform hand hygiene, and apply new gloves. So I'm just going to assess the skin, looking for any redness, swelling, making sure I count the sutures or staples, making sure they line up with what the physician had placed during surgery. Okay, so now I'm going to get all my equipment ready. I'm going to open my gauze. Open my pad. And I already have my tape available here, but at this point in time, I would cut my tape and get it ready to make sure it fits my ABD pad. So here I have some normal saline. I'm just going to be checking it for the expiration date. It's still good, it has not expired. I'm going to cover the label with the palm of my hand, undo the top, and just lift it into the garbage, just doing a little. And then I will pour it over my gauze to get it saturated. So now that this gauze is wet, I will use this to clean the incision site. And you kind of crunch it up like a wonton, making sure your fingers do not touch the incision site. And starting away from me, I'm going to clean first. So I will drag this way, discard, and I will grab a new one. Now to save some time in this video, I'm just going to verbalize the rest. So I would drag, starting from the inner to outer, discard, grab a new one. Discard, let me grab a new one. Discard, grab a new. Now do this all the way down this side away from me, discard. Now I'm going to come closer to me. And start back up here, pull it away, discard, grab a new one. Discard, grab a new one. Discard, grab a new one. Discard, grab a new. Do this all the way down, same way I did it from clean to dirty. Throw that away. So now I would grab a new piece of gauze that's still wet, and I'm going to just slide down the middle of the incision. Since that's clean, I can discard that, and I'm going to grab me some dry gauze now. Still fold it into a little wonton to protect your fingers from touching the patient's skin. Since this is now clean, we're gonna pat dry in the same motion we cleaned. So pat, pat, starting from the incision line out. Discard, grab a new piece of gauze that's dry. Pat, pat, discard, get a new piece. Discard, grab a new piece. And I would do it all the way down the same. Grab a new piece, discard, throw it away. So now I would grab a new piece of gauze and clean or pat dry this way. Pat out, discard, get a new piece. Discard, grab a new piece. Kind of repetitive, but we need to make sure it's all nice and clean so the patient doesn't get an infection. Grab a new one. So that side is completely clean, we'll throw that away. We'll grab a new dry piece, and now we will pat all the way down the middle. So now it's all completely clean. Discard. So now I will grab a new piece of dry gauze, kind of fold it so where it fits over the patient's wound, along with my ABD pad. Move that if need to be. Place, and since I already have my tape here, it's easy access to just grab. And we pull down all sides. I could have taped that a little better and I can fix that. See, it's coming up, so I just need to get a few more pieces. Tape it down. I would grab a piece of tape, place it on top. This is where I would grab my pen and do my name, date, and or initials and date, so the nurse knows when I last changed it. Also would put the time I changed it. That way the nurse sees when it was last changed, because if I don't do that, they'll automatically just come in and change it because they won't know. So then I'm done, so I can cover him back up. I would remove my gloves and perform hand hygiene. I would document what I did, so a dry dressing change. I would document anything I saw, so what I saw in the first ABD pad, what I saw in the incision, if there was any swelling, all of that. I would also document how the patient responded to the procedure, such as how they handled it, and this patient handled it well. So that's all I would document and for that procedure. So now let's talk about a few dressings. So there's about 6 or 7 main dressings we need to talk about. The first one is gauze, which is what we used here. This one is for wet or dry dressing changes and can be used to packed wounds. The next is a transparent dressing. This is used most commonly on IV sites or skin tears. It allows you to see the wound without removing any dressing. The next is your hydrogel, which provides moisture to dry wounds. You have your hydrocolloid. This is for a small amounts of exudate. Then you have hydrocolloid. You have your silver impregnated, which I've actually used in the hospital setting. And this is used as antimicrobial and used for infected wounds. You have your alginate and hydrofibers, which are used for large amount of exudates. You have your foams, which provide moisture and just help protect it. Then you have 3 types of drains, which include your Jackson Pratt, your Penrose, and your Hemovac. Your Hemovac and Jackson Pratt are kind of similar when they are both closed suction, and they have a device at the end like a bulb or a glass container, which you compress together and acts as a suction. As blood and fluid come into it, it'll fill up, knowing when it needs to be emptied or to see if the drain is working. The Penrose is like a flat little tube that lays along the incision line and removes blood and fluid from the incision site. All these are most commonly used post-op.